So, welcome to our five-part series on managing diabetic cataracts in dogs. We're joined by veterinary ophthalmologist Dr. Kellam Bayley, who's going to walk us through what are diabetic cataracts and how do we know if our dogs are starting to develop them.
So, um, diabetic cataracts are a really, really common thing that we see in dogs with diabetes, particularly those dogs that are sort of younger or middle aged. Um, and the symptoms that you see are really, really pretty obvious because they tend to develop vision loss quite rapidly over a few days to maybe a week. And so you'll have this happy, healthy diabetic dog running around playing, doing all its normal stuff that will then get quite significant progressive vision loss over a short period of time. And the majority of them become blind. I mean, they become totally non visual in that period. It's often also associated with some obvious increase in cloudiness in the eyes. So the cataract makes the eye look more opaque, sort of smoky, foggy color. And the white of the eye can also become quite red because it can be a bit inflamed.
So, what I'm hearing is that most dogs are going to develop it, and owners really need to be aware of sudden changes in their dogs that could indicate a change. So, color of the eye might become white, or they might be having more difficulty moving around the house or bumping into objects.
Yeah, that's about right. And so, if you're noticing that you're worried about vision loss in the dog, diabetic dog, then look, it might be related to cataracts, but it is possible it's related to things that aren't the cataracts. So, good sort of starting point if you're noticing that sort of thing would be to arrange an assessment with your vets just to see what's what.